Hello and good day. I'm Dr. Amina. We're here talking about problems that are associated with breastfeeding. Like we've already established previously, breastfeeding is an important aspect of newborn care. It provides the nourishment that is expected for the baby, and the miracle of breastfeeding is that depending on what stage of pregnancy the baby was born, the breast milk that is produced by the mother complements the type of baby that she has to deal with. For example, if the mother has a term baby, the breast milk being produced is breast milk that is needed for a term infant. And if the baby mother had a preterm delivery, then the breast milk produced by the mother is what a preterm baby requires to nourish the baby, considering the fact that the baby came out early. So it's important that we establish and ensure that these babies are breastfed adequately. Now, there are a lot of problems that may arise while a woman is trying to lactate and breastfeed her baby. And I'd like to highlight a few of them and possible solutions to these problems. Chief amongst the possible problems that mothers would have is the issue of sore or cracked nipples. And it's very common, especially among new mothers or women who are trying to breastfeed for the first time, due to poor attachment by the baby, in that rather than the baby's mouth being applied around the areola of the breast, the baby's mouth is around the nipple and the baby sucks on the nipple. This can result in cracking and painful nipples for the mother, and breastfeeding becomes painful. And like I mentioned in previous episodes, the state of the mother helps in the production of breast milk. And if the mother is having pain and she has anxiety, this can also negatively affect the volume of breast milk that is being produced by the mother. The solution to this is to ensure that there is proper attachment by the baby, ensure that the baby is properly positioned, and then the mother can have some warm compress to soothe the breast while she's not breastfeeding, and also apply some of the breast milk onto the cracks on the nipple, and it is expected to heal within a few days. If, however, it does not heal within a few days, she may need to see a medical specialist for correction of whatever is causing it. Another problem that we have with breastfeeding is the issue of engorgement. Sometimes maybe the child is not sucking well enough, or the baby is not attached well enough. The child may not, or the mother is not feeding the baby as frequently as she should. And some children, especially in the first few days, they sleep a lot. So the babies will not suck as well as they could, because the baby is expected to have at least 8 to 12 feeds in any given day. And if this child does not suck within this frequency, and the mother is lactating adequately, there's a tendency for her to have engorgement of the breast, and this will result in pressure, pain, and discomfort. And like I said, pain can now have a negative feedback on breast milk production. So the solution to this is to ensure that the baby feeds at a regular frequency. If the child sleeps a lot, mother may actually need to wake the baby up from sleep to come and breastfeed, and ensure that if the woman produces a lot of breast milk, she has the option of getting a breast pump and actually expressing the extra breast milk and storing it in the fridge. Breast milk that has been kept in a fridge can actually be used within 24 hours, and if it is frozen, it can stay for up to 3 months and can be thawed and given to the baby at another time. However, it is important to note that any breast milk that has been frozen and thawed should not be refrozen. Next problem that a mother could have is not producing adequate milk. Some women may not be producing adequate milk, and like we mentioned already, it is important that her nutrition and hydration should be looked into, because if the mother is not taking in enough fluids, there will not be enough hydration, and there will not be enough breast milk produced. So solution to not producing enough is to ensure that the mother takes in a lot of fluids and adequate nutrition. Also, the sucking by the baby is it's a prompt for the body to produce the hormones that are needed for production of breast milk. So regular sucking by the baby is also part of the solution to mother not producing enough breast milk. So we have mothers who on the first few days, they will tell you the breast milk is not flowing, they are tired, they don't want to put the baby to breast. No, they should put the baby to breast, and frequently within those first few days, so that they establish a regular pattern from early on in the history of breastfeeding that baby. Another problem that they may come about is what they call mastitis. This is when there is an infection of the breast tissue. This mastitis can result, maybe there was a cracked nipple and then there was an introduction of infection through the breach in the skin of the breast. Whatever the cause of the infection, it can be very painful, and the mother may need to actually visit the hospital to get some treatment. Sometimes they may actually need to be on antibiotics, and people tend to think they should not breastfeed with the breast that is having an inflammation, but they actually need to keep on breastfeeding with that breast, because where the infection is has no relationship with where the breast milk is coming from. So it is advised that they keep feeding with the same breast, but they should be on antibiotics and pain relievers, so that the pain that is associated with the inflammation will not cause a reduction in the breast milk that is produced. Some women may have the problem of having what we call breast leakage, in that because they probably go to work and the baby does not suck so often, and the mother is lactating well, then they will now have breast milk and they'll coming out when there's a letdown reflex, and then there's release of breast milk, and the mother will now have breast milk patches on her clothes. So it's advisable, it's a solution to that, is for her to make sure she uses at least cotton breast pads that will help with keeping whatever excess fluid that comes out away from her clothes. These are some of the problems that a mother may have when she's trying to establish breastfeeding and breastfeeding her baby. They are not reasons for a woman to stop breastfeeding. They are not reasons for a woman to decide, okay, I cannot breastfeed this baby, I need to give this baby breast milk substitutes. No. What she should do is to continue breastfeeding her baby. If in the hospital she attends, they have lactation specialists, she can consult them so that they will advise her adequately. Otherwise, it's advisable for her to see her doctor, and she'll be advised on what to do to help with such situations. I hope you've been able to get some tips from what I've said about the problems that could arise when the mother is trying to breastfeed her baby, and I hope that it has been of some help to some people who may have been having similar problems. If you have any other questions or comments, you could help us mention it in the comment section, and we will see you next week. We'll be talking about myths surrounding breastfeeding. Thank you for watching. I'm Dr. Amina. I'll see you at the next session. Thank you.